And if I'm being very honest with you, this was not the job I was going for. Being a case manager in the home care setting was not the job I was going for. I was just so desperate to leave bedside. What's up, you guys? My name is Jody. I'm a former NICU nurse, now transitioned to infant and pediatric case management. And if you are interested in learning about what it's like to be a case manager, or if you're just on the fence on deciding if you want to leave bedside nursing, I'm going to go into details, the pros and the cons of what it's like to be a case manager. So if you want to learn more about my journey, keep watching this video. Being a case manager comes with a lot of perks depending on what department you work in and what kind of case manager you are. There are a lot of home care case manager jobs that are completely remote and you're just out in the field. So a plus for my job is that it is low stress. I kid you not, I'm only 6 months in, okay? And I feel like I've seen everything that I need to see, and this is probably the worst it's gonna get. I think what makes the job stressful, or what makes any job stressful, is if you have low staff and you have a high caseload. Right now, my team, with my current team, the caseload is distributed equally. So I have 17 patients on my current caseload. So it's very manageable. It's very manageable for me. You have some case managers, for instance, if you're in the hospital setting, you can have up to 50 patients. Some places 100 patients. It just depends on what side of case management you are on. That will determine the level of stress and the level and the amount of patients that are on your caseload. So I would say that's number one. It is a very low stress, chill job. For it. Pro number two for being a case manager. This is going to be very controversial, but I feel like I have way more work-life balance now that I'm a case manager than when I was at the bedside. And I know a lot of nurses are going to say, what, Jody? Like, you only work 3 days a week being at the bedside, and now you work 5 days a week. So how the heck do you have more work-life balance? And hear me out. I feel like I have more work-life balance now because every single day for me is extremely consistent. Every week for me is consistent. Like, I know I'm going to work every Monday through Friday, and I need to get to work by 8:30 a.m. and I'm getting off at 5 o'clock. Okay? I have specific time frames and I have specific days. Unlike being a nurse at the bedside, every week looks different. You're not working Monday, Tuesday, Wednesday every week. And sometimes you don't have your days, Your days aren't grouped together all the time. So at the bedside, you might work on Monday, Wednesday, Friday, and God forbid you work a night shift and your days are split up like that. So I really did not like that about bedside nursing. I mean, a plus is that you can work several days in a row when you're at the bedside and then take a week off or whatever, however you can do your schedule. Right now, I cannot do that because I work Monday through Friday, so I only get weekends off. So if I want to have a long weekend, I would have to call out sick or, take the day off or something like that. But honestly, the trade-off is very worth it for myself. So I feel like I have way more work-life balance because none of my friends are nurses. All of my friends are in corporate America. None of my family members are nurses. So now I'm on the schedule of the people in my life. I'm on the same schedule as the people in my life. And I get to meet a lot more people in so many different industries. I work in dead smack in the middle of the city. So I get to meet so many different people. I meet entrepreneurs, finance guys, people on Wall Street, just tech bros, engineers, like I'm not always just surrounded by nurses, so that's been pretty good for me in terms of networking, getting to know different people, getting to know different industries, and even for my dating life. Because so before I became a case manager, literally planning dates was like, I did not know how I was going to plan dates because I pretty much worked every single weekend or every other weekend. Like it was just hard to coordinate meeting up with people or even going on dates. So I have way more work-life balance now that I'm a case manager and I'm in corporate and I work like a typical 9 to 5 schedule. So I would say that's one of the major pros of being a case manager. So the last pro I'm going to talk about is the flexibility that this job has given me. And it's weird to say again because I do work a 9 to 5 schedule, but being a case manager, like a field-based case manager, meaning that you're out in the field almost 75% of the time, but that just depends on how you schedule your visits. So for me, as a case manager in the home care setting, I do have to visit my clients. So it just depends on when I schedule them. My job gives me a lot of flexibility to do video visits at times, and every 60 days I do have to visit each and every one of my clients. So it just depends, but I have way more flexibility. For instance, I don't necessarily have to be at work at 8:30 every morning. So if I plan a visit, my visit's at 10 o'clock, I'm not going into the office and then go to my visit. Like I'm going straight to my visit, which basically gives me more time at home. And then I just head, to my visit. So we're a very close-knit office. It's not a lot of us in the office, so we just communicate through Teams. Whenever we're doing visits, we put it on the calendar. And another thing that I really love is that as a case manager, you have a lot of autonomy over your schedule. So my director doesn't tell me what to do, when to do it. I decide when my visits are. I decide, like I have deadlines. I have things that have deadlines that I have to meet. But essentially, I have a lot of autonomy over how I get things done, when I get things done, as long as I get them done by that deadline. Okay, so now let's get into the cons of being a case manager. Like any job, you're gonna have cons. No job is perfect, and case manager certainly is not perfect. And again, depending on what side of case management you work in, and depending on your office, your company, it may or may not be great. Maybe I got lucky and I just so happened to work for a decent office with a decent director for a decent company. But again, everything is a leap of faith and you won't know until you try. Like being a case manager in the home care setting was not the job I was going for. I was just so desperate to leave Bedside. It was just affecting me so negatively. My health was declining. I felt like complete crap every single day. I felt miserable being there. And mind you, I was in a NICU with babies. This was my dream specialty, So it wasn't NICU per se, but it was just the stress of being a bedside nurse that burnt me out earlier than it should have. Cons of being a case manager, at least specifically for my job. One thing I do not like about what I do is the fact that I have to do home visits. I feel like the feds. When I go do these visits, because essentially I'm their superior, like the nurses in the home. I'm responsible for them. Like I oversee the nurses and I make sure they're doing what they're supposed to be doing. And I also oversee the care of the patients that they're taking care of. So every 60 days, I have to go do a home visit, but every 30 days, I have the option to do a home visit or a video visit. Child, I live in New York. Y'all know I'm gonna do that video visit because ain't nobody got time. Okay, unless I really need to, I'll go do an in-person visit at the 30-day mark, but based on policy, every 60 days. Cool. So I don't necessarily like that part because living in New York, depending on your service area, I service Staten Island, the Bronx, and Manhattan. Those are my territories. So transport alone, it takes hours. Going to the Bronx is like an hour and a half for me. Going to Staten Island, same thing. Like the transport is a lot. So I don't like that part of it. I don't like doing the home visits, but I don't do them that often. I only do them every 2 months, or as needed. So it is what it is. It's manageable for now. Like I don't completely hate it. Okay. So another thing I do not like, I absolutely hate about my current job, I would say, is that we have rotating on call. So we have an on call service. So whoever calls after hours, it'll go to the on call service. And if that person or if a nurse calls and they need a manager, it'll go through to the case manager that's on call for that week. So I don't necessarily like that. But for the few weeks that I've been on call, I barely got any calls. So it's not on call where like I have to get up at my house and go see the client or go see the nurse. It's not like that. But it's on call, meaning like if they call me, I need to be available to answer their question or guide them. For instance, a couple days ago, I had a nurse call me. Her client was having a seizure. She didn't quite know what to do. She told the family. The family didn't want to take the child to the hospital. So then I had to talk to the nurse, talk to the family, tell the nurse what to do, that type of thing. Eventually the family didn't want to take the patient to the hospital. And I said, well, that is outside of what my clinical recommendation is. And obviously you cannot force a family to do something that they don't want to do. So I did my part. I write up my report. I submitted an incident report, all the, a lot of paperwork stuff. And come to find out a day or two later, they ended up having to take the patient to the hospital because they seized again. Okay, so it's that type of stuff. That's one of the more extreme things. Other things nurses call me about would be like how to give a med or very small things. So although I don't necessarily like on-call, it has not been bad for me at all. And to sum it all up, my last con would be deadlines. This job is pretty much all about deadlines and compliance and documentation and paperwork because we're overseen by the state department, the health department. We have our own internal auditing department that we report to. So a lot of my job has to do with compliance, documentation, paperwork, reporting things that are appropriate, right? So deadlines are a big thing. Your visits, when I do my home visits, I have a deadline for those. When I need to submit my report, I have a deadline for those. So it really does test your time management skills and also your clinical skills. So whoever said that you don't use your clinical skills and your skills as a nurse outside of a bedside, they're lying, because I still have to use critical thinking. I still have to use my time management skills, which I learned at the bedside. Okay. So there you have it. Those are the pros and cons of being an infant and pediatric case manager as opposed to being at the bedside. And I'm very grateful for the job that I do have. I think I lucked up because not many case managers have a low stress case management job. I never want to paint the picture that case management is the perfect job to get into. It has its challenges, it has its cons depending on where you work and who you work with. But if you do it and you do it right and you research and you vet the company and you really vet the role and ask the right questions during your interview before you accept a position, then it'll really set you up for a very chill, low stress case management job. If you like this video, please subscribe. Please drop a comment if there are any topics or questions that you have on being a case manager. Bye.